Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show is sponsored by Mark Drugs, who specialise in the custom compounding of medications, assuring that the client gets the proper prescriptions for their unique needs and conditions. They work with practitioners, integrating knowledge and treatment of experts to create comprehensive health plans. Visit markdrugs.com or call Roselle 630 529 3400 or Deerfield 847 419 9898. Today we're joined by Dr. Esther Konigsberg, who is the Medical Director at Holistic Natural Health Integrative Medical Consultants Inc. in Toronto, in Ontario, in Canada. Thank you for joining us today, Esther.
It's my pleasure. Thanks for having me, Linda.
Well, it's so exciting. We have very few Canadian doctors who we've spoken to so far, so that's going to be of real interest. Can you tell our listeners, your background, please?
Certainly. So I'm a medical doctor, and I had been practicing as a family doctor, so I'm with the Canadian College of Family Practitioners as well. And I had been practicing conventional medicine for probably about 17 years. I've always had an interest in holistic and integrative medicine. And in the mid-90s, I started to study with Dr. Deepak Chopra and started teaching meditation and wellness courses based on Ayurveda. And then, and so as a family practitioner, I became known for that, and I started to attract a lot of people who are interested in a more holistic approach to health and wellness. And then I did a fellowship in integrative medicine through the University of Arizona between the years 2001 and 2003. So then, after 17 years, I opened up a family practice center of integrative health and healing, where I practiced with an array of complementary and alternative medicine practitioners, and at that time, I practiced integrative family medicine. I had that center for 5.5 years. And I wound it down after that for various reasons. And then in 2010, I started practicing solely as an integrative medicine consultant. So that's where I'm at this moment in time. I've left primary care, and I just consult to patients who are interested in a more holistic approach.
Mm-hmm. So are you treating, from babies to geriatrics?
Well, I treat whoever shows up. So people find me, mm-hmm. and because there's not a lot of people who are doing what I'm doing, as you can well imagine.
Yes.
So probably the youngest person I've seen to date would be about 6 years old, and I've seen everybody, and then right up into the elderly. I think recently I had a patient who's 82 years old, mm-hmm. And everybody in between.
Okay.
So I do see a wide range, yeah.
Mm-hmm. And could you just go into detail of the different therapies that you use within your practice?
Certainly. So being an integrated medicine physician, we understand that there's a whole lot of layers to what creates wellness. So, it's it's our relationships. It's, how much stress do we have in our life? So I do a lot of stress management, and it also ends up being a lot of counseling as well. Kind of life coaching, because, it's just trying to help people find their own particular balance. Sleep is very important in there, and we discuss sleep hygiene as well. I give physical exercise prescriptions, too, to make sure that people, are doing what they can within the limitations they have to stay physically active and strong and to help them prevent illness and disease. I do a very big nutritional intake, and I give very specific nutritional advice. And I do some testing, some food intolerance testing, which is an IgG testing, and, help, not with all my patients, but with many of them, to help be a lot more specific about my nutritional advice and an anti-inflammatory diet. I deal with a lot of supplements, so that's vitamins, herbals, botanicals is part of what I do. A large subset of the patients that I see also come to me for, they're transitioning through different stages of their hormonal life. So I also prescribe bioidentical hormones where appropriate. I also prescribe thyroid hormones where appropriate. And then in the last few years, the other thing that I've added to my practice is low dose naltrexone. So a lot of people are finding me specifically because I do prescribe low dose naltrexone.
Mm-hmm. Could you just walk us through, a patient comes to see you and says that they are feeling unwell and give you this long list of symptoms that they have wrong with them. How do you go about diagnosing and finding out what the problem is?
Well, quite frankly, most of the people who come to me I'm more of a last resort person. Mm-hmm. And so what's happened is there are very few people who don't walk into my practice with a diagnosis. Most of them have already gone the gamut of conventional care, mm-hmm. and they're still not feeling well enough. So they still have a various amount of symptoms, or they're concerned about the medications they're on and the possible side effects that they may experience years later, or the side effects that they're experiencing currently. So it's infrequent that I come up with a new diagnosis for most of my patients, because usually they've been well worked up and they come with a pile of their tests and consultants' letters, etc. So again, I'm somebody who they're coming to because conventional medicine is not fully helping them at that time. Okay,
so they have all the results and you unravel everything and work out a plan on how.
Certainly. So, mm-hmm. What I might do differently is, an easy thing is, let's say a menopausal woman, they may not have had all the tests that I would do. Mm-hmm. So I may do an expanded array of hormonal testing for that person. So again, it's not necessarily diagnostic because we already know what the diagnosis is, but now I'm starting to do testing that will help guide me in helping to manage any particular patient.
I mean, I've had people tell me that they've had thyroid blood tests to check their thyroid, and they've come back negative. They're told that they're fine.
Exactly. Conventional medicine gives a wide range of normal thyroid function. So, and they tend to suggest treating when a person is significantly hypothyroid. And then sometimes what happens, so I'll see two different sorts of patients. I'll see some who will come in and say, I'm sure I have some thyroid issues, and my doctor says, no, you're within range. But they're in the upper range of what's considered normal in conventional medicine, upper meaning hypo, or the other thing we could call it is thyroid dysfunction. And for those people, when I push their thyroid by giving them some supplementation into a narrower, a more optimized range, a lot of those symptoms are alleviated. So I see some of those folks. I see some folks who are just on Synthroid, which is T4, which works for a large amount of the population, but not for some, because many of us don't convert T4 to T3, which is the more active form of thyroid hormone. So sometimes by switching them from Synthroid to a T4, T3 combination, again, they start to feel a lot better. So, there's a wide range of things that I can do that at this moment conventional medicine is not addressing.
Mm-hmm. And what would you say in a typical month, other than the thyroid patients, would you say you are treating?
So I see a lot of autoimmune patients. Rheumatoid arthritis, varying degrees of colitis, lupus, ankylosing spondylitis. And I see also cancer patients, and unfortunately most of the people who come to me are already stage 3, stage 4 cancer. Mm-hmm. So I also see a lot of cancer patients too, digestive issues, some mental health as well, and, such as anxiety, depression, and again, a lot of hormonal.
And how do you find LDN treats those patients? I mean, have any of them ever said to you they've had any adverse side effects?
Sure. It's a huge spectrum, I find, of results with Low Dose Naltrexone. And that's basically what I tell our patients is, unfortunately, at this moment in time, the big pharma is not really all that interested in doing randomized double-blind control trials with low-dose naltrexone because it's an off-label use and they don't really stand to profit. So anecdotally and also experientially, I've seen a wide range of results, some phenomenal results, and then I've had some people who don't experience that many results, and then I've had some people, a few, not very, most people don't have adverse results where they have to come off of it. But I can think of one patient in particular who felt that she had an increase in anxiety on the low-dose naltrexone and wasn't able to tolerate it. But for most of my patients, and we started varying degrees and slowly titrated up, most of them are able to deal with the minor side effects, which is usually a transient sleep disturbance. The vivid dreams are not usually too difficult for them to manage. Some of them are quite happy because they hadn't been dreaming for a while. And I've had a few who we can't go the full dosage. Specifically, and I forgot to mention multiple sclerosis. I see a lot of multiple sclerosis. Some of them, I find sometimes they get to a certain level and we go beyond that level, and some of their symptoms are exacerbated and we go back down and they still maintain their improvements without fostering the side effects. So, and this is the whole idea about integrative medicine. And I think, now that the genetic code has been broken and we're starting to learn more and more about genes and pathways, is that people are individuals. They don't all react in the same way to any given medication. And that's what I've been seeing with low-dose naltrexone. Mm-hmm.
And do you have any Lyme disease patients?
I don't tend to see Lyme disease. That's something I've shied away from. And actually, when you were saying about diagnosing, there's been a few patients who've come to me with some non-specific symptoms that I've ended up thinking that perhaps they have chronic Lyme. Mm-hmm. And then I suggest that they go see a Lyme-informed and educated physician. Mm-hmm. And one patient said, quote unquote, that I saved her life. by diagnosing it. And she had been to Mayo Clinic. She'd been seen over 20 other consultants before she came to see me. And when I put it all together, so when we were talking earlier about a diagnosis, that was the one. She did go and see a Lyme-informed doctor, had her testing done. She was positive. She's in treatment, and she's getting better.
Oh, that's great.
Yeah.
And you were talking about allergies. What has the results been for LDN with allergies? Because having gone over to the States quite a few times now, over in England, the allergies we have are nothing like the allergies people over there have. It must be whatever is in your air over there, but people genuinely seem to suffer more with allergies than we do.
Yeah, you know what? I haven't had too many people with allergies come to me for low dose naltrexone. And usually, occasionally, when people are coming to me for other things, I will then bring up low dose naltrexone. But most people, they're kind of self-identified, and they found out information about low dose naltrexone. Their physicians will not prescribe it, and then they find me. I can think of one guy, I think he's in his 20s, who it's not allergies, but he has a very rare congenital condition. And sorry, I don't remember the name of it, but it's where he actually grows bony tumors. So it's almost like a neurofibromatosis, but it's actually happening in the bones. But another part of his symptomatology is itching. He's, and to a very uncomfortable degree. And the low dose naltrexone has basically reduced it by about 80 to 90%.
Wow.
So when you bring up allergies again, I don't think I've had that many people come to me for that, but specifically that he had quite a remarkable improvement in those symptoms, which really made a difference to his quality of life.
And you also said that you prescribed it for mental health. What has the results of that been?
For people with mental health, well, low dose naltrexone, the theory is, of course, that it increases endorphins. And I think people, overall, one of the really side benefits is there's an enhanced sense of well-being. And I would say that for some people who've been lacking that sense, that it helps. But again, with my multi-pronged approach, I'm also using other things simultaneously along with the low-dose naltrexone for those people. I can't really specifically weed that one out. I would say that some of the most phenomenal results I've had is within multiple sclerosis, in actual fact. Those have been some of the most exciting results that I've seen, where a patient of mine was having a lot of issues. She was getting to the point that she's in her late 30s, early 40s, difficulty walking. She's had such an improvement that she's back to horseback riding now.
Yeah.
And which was such, a huge thing for her. And she's actually able to exercise, and she hadn't been able to for quite a while. So I've had, a few really, she stands out in my mind, but a few very definite improvements with patients with multiple sclerosis. Another one that had an outstanding improvement was a 19-year-old patient of mine with severe ulcerative colitis who, she could hardly eat anything. And she was also on, biologics through her gastroenterologist, which was just keeping things under control. We also did food intolerance testing. So again, multi-pronged approach, including the LDN, and now she's able to eat a very healthy diet. And whereas she was getting IVs every 4 or 5 weeks, they've been able to lengthen it out to every 8 weeks. So she's been able to basically reduce the biologics as well.
Oh.
And, she's feeling so much better.
Mm-hmm.
So, she's another patient who's had some really exciting results too.
So our listeners, if they are wanting to come and have a consultation with you, how would they go about that?
Well, they call one or the other of my offices. I work out of 2 different clinics, one in Toronto and one in Burlington, Ontario. And they just need to call. And if they just go on my, if they just search my name, you'll find me. Or if you search Integrative Medicine Consultants, Inc., you'll find me. But I work out of, 2 different clinics, and they just need to call and book an appointment.
Okay.
And
do you only do face-to-face consultations?
I prefer that if possible. I prefer the first appointment to be face-to-face, and then follow-up appointments can be over the phone or Skype. But just recently, I've, reviewed my college's guidelines on telemedicine, as they call it. And if somebody is unable to come in, be it for physical problems or distance problems, I've now started to do all of it through Skype, as long as it's not detrimental to that person's care. So if there isn't something that we find that really, they need to be face-to-face. But generally speaking, as I've mentioned before, most people are under the care of not just primary care physicians, but consultants as well. So usually I'm just an addition to the care. And that's the way I like to approach it. I don't want anybody to drop any of their specialists or their primary care physicians. I'm not working as a primary care physician. And the idea is that everything's supposed to work synergistically. And if they're seeing an improvement, much like that young woman whose gastroenterologist saw an improvement, then they, their specialist can start to reduce the other medication.
Mm-hmm. So do I take it that you will contact their primary physician and work together?
Only with the patient's permission or request.
Mm-hmm.
Because unfortunately, some patients are concerned that if their other practitioners know that they're doing something outside of conventional medicine, that it may be detrimental to that relationship. So I honor the privacy of each patient. And if I think it's really a good idea, I'll mention it to that patient, but it's ultimately the patient's choice.
Wonderful. Well, thank you very much for being a guest on the show today. We've learned a lot from you.
Thanks for having me.
It's been very interesting.
Thanks for having me. But thank you, Linda. And so, again, it's really added another layer to my practice. So, thank you for all the good work you're doing.
Thank you very much. This show is sponsored by Mark Drugs, who specialise in the custom compounding of medications, assuring that the client gets the proper prescriptions for their unique needs and conditions. They work with practitioners, integrating knowledge and treatment of experts to create comprehensive health plans. Visit markdrugs.com or call Roselle 630-529-3400 or Deerfield 847-419-9898. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.